Hi everyone, Whitney here with another one of our clinical quick tips from the Academy. Today's note comes from a reader who sent me a note inquiring about whether or not it was safe to work on somebody with a herniated disc. This is a question I get a good bit, and there's a number of things that we want to take into consideration that would make that determination of if it's safe or not. There's a couple of key factors that we'll look at with some of the anatomical structures, where they're located and what might be particular precautions. The other thing that's going to be really important is assessment processes that go into this, determining what kind of motions aggravate the symptoms from that disc, or in fact if there really is disc pressure that's producing them to begin with. So let's take a look at some of those key clinical factors here that make a determination of whether or not it might be safe to do that in our treatments. Okay, so if we come over and take a look at the lumbar spine where the nerve roots are located, we can see here's of course the transverse processes right here. Spinous processes are right there. And then we can see the little covering around the nerve root itself. This is right where that nerve root exits through the intervertebral foramen. That's where the disc is pressing on the nerve. If we come over and take a quick look on the front side, we can see again, here's that intervertebral disc right here. And this is where the disc is going to be pressing on the nerve root right there. Now, our key concern is what's going to happen as we try to work on the muscles of the low back region with that disc pressing on the nerve root. The important consideration here is to look and see that the transverse processes and the intertransverse ligaments right here prevent us from being able to press directly on those nerve roots where they're getting compressed by the intervertebral disc. So for example, if we add in some of the muscles that are in this area that we're going to be working on, you can see we can work directly on those muscles, but the transverse process is going to prevent us from pushing directly on the nerve structures and further irritating that location of nerve root compression. Now, we can't press directly on that nerve root where the herniation is occurring, but your pressure along the entire spine could move the vertebra a little bit, just sort of shifting it in position, and that might cause the nerve root to get pushed against a protruding disc. So it is possible to make those symptoms worse and to aggravate it if you put too much pressure in that area that moves the entire spine. But you're not going to be pressing on something that's going to press the nerve against the protruding disc. So you can feel pretty confident with that. So in a nutshell, just be cautious, and in most cases you're going to be fine working gently and thoroughly through that whole area with all the lumbar musculature. Okay, great. So we've taken a look at some of those key anatomical factors that will play a role in making that determination of if it's safe to work on somebody with a herniated disc. In a nutshell, I think we can usually determine in most cases it's not going to be a problem as long as we take certain precautions into consideration and don't work too aggressively in there, pay attention to symptoms, and notice anything that might potentially increase the symptoms that our client is experiencing. The other thing that's important is just make sure that we don't put excessive pressure on those areas or do anything that moves the spine significantly in a direction that aggravates any of those symptoms. If you want to learn more about disc herniations, all kinds of other low back problems, and many other orthopedic disorders, come on over to the website at the Academy of Clinical Massage and learn a good bit about what we do with our orthopedic massage courses, learning all about assessment and treatment of a wide variety of pain and injury complaints. There's lots of people out there who could really use your help, and our goal is to really provide the best educational experiences for you in orthopedic massage so you can become a highly successful clinical practitioner. We'll see you over there.